Austria, Germany and the Netherlands are all seeing surges in COVID infections and deaths. So why isn't that happening here? And can the government really be confident in sticking to Plan A? Well, a quick glance at the numbers and you can see why those countries are considering lockdowns. Rocketing case numbers in the Netherlands, here in dark blue, Austria in grey, and light blue, Germany is now about level with the UK, but cases are rising fast. So what's going on? Well, vaccines could have a lot to do with it. As you can see here, the UK's uptake was faster and started earlier. Germany and Austria only reached our levels of coverage in recent weeks. There was also a shorter gap between doses for much of these countries' rollouts. Combined, that could translate into lower levels of protection overall. On top of that, here we started booster vaccines over 2 months ago, and the over 12 started getting jabs last month. The more people you vaccinate, the fewer there are to infect. But timing is probably crucial too. Let's look at cases again. Infection rates have been kept low in many parts of Europe through a combination of restrictions through late summer and autumn. In the UK, we opened up in July and we stayed open. We're not seeing this late autumn wave because we've had high case numbers for months.
Over the summer months, when we were experiencing a big surge driven by the more transmissible Delta variant, they had very low numbers of cases. We have, as a consequence of that wave over the summer, a lot higher natural immunity, and superimpose on that natural immunity, obviously, is vaccine-induced immunity.
There's certainly evidence for that. Look at COVID antibodies in 16 to 24-year-olds in England, up at around 96%, yet only 84% have had at least one dose of the vaccine. Compelling evidence of natural infection topping up vaccine protection. So is this a vindication of the UK's strategy? Well, let's look at deaths with a COVID infection. You can certainly argue we've avoided a winter surge so far compared with others, but at what cost? For months, the UK, that's in red, has been averaging 100 to 150 COVID deaths a day. Since we opened up on July 19th, nearly 15,000 people have died with COVID. On top of that, there's the impact of severe illness and the drain it's putting on the NHS. We're sticking to Plan A, but there are many cold winter months still to come.